Sound check. Hey, good evening, everybody. My name is Dr. Nathan Thompson with the Wellness Way, Yorkville. Happy Monday, guys. Hope you had a great weekend. Just making sure my mic is on. Thank you guys so much for joining us. Thank you for joining us every week for our live broadcast. Today, I'm going to be talking about common skin conditions that are not normal. And so last week, I went over a lot of common conditions because they're so common. People now think that they're normal. But I'm going to talk about things that can happen to your skin that just because a lot of people have these things that they now start calling them normal just because they have become so common. If you are joining us right now, please do me a favor. Please say hello. Let me know also where you're watching from as well. So this will be a very, very good broadcast. Make sure you watch it all the way through. And if you don't have an opportunity to, make sure that you go back and watch the replay. I do know on Facebook, the replay will only be available for about 90 days, but you can go back on YouTube or on Rumble and watch the whole entire video. But if you're watching live right now, thank you guys so much for joining me on this beautiful Monday evening. So let's get into it. So what am I going to talk about tonight? Common skin conditions. What do they mean? Here's what I'm going to be talking about in a little bit of detail. Bumps on the back of the arm, rosacea, hair loss on the ankles, toenail fungus, dark circles around the neck, age spots, or what they would call liver spots, and then the dreaded granny hump. I will talk to you in detail about that, how it actually will change so many different things, especially even your facial structure as well. And so if those things caught your attention, or if you suffer with those things, and if you're from the Chicagoland area, please make sure to get to our next inflammation event. That's going to be tomorrow, April 29th at 6 o'clock p.m. This is an in-person event, our approach to inflammation, because yes, the things that I could talk about with the skin have very common triggers that's going on. So it's very, very important that you start correcting the causes as far as why they are happening. I love when people say we're getting to the root cause. I'm like, I'll show you at the end why there's root causes that are taking place. And guys, there's more than usually just one. And that's why you have to look at everything together like the Swiss watch. So whether you need help with weight loss, or whether you have cancer, infertility, thyroid disease, arthritis, type 2 diabetes, autoimmune conditions, or any kind of hormone imbalance. There's a very common component with all of these. Make sure you get registered for that inflammation talk. That will be tomorrow night at 6 o'clock here at the Wellness Way in Yorkville, Illinois. We start promptly on time. So if you register for it, make sure that you are committed to showing up. All you got to do is just go to our Linktree profile. You'll see this pop up as one of the first things that'll take you directly to Eventbrite. If you click on that link, you can get registered for it. Take you about 60 seconds. And then a member of my staff will reach out just to confirm your attendance at that event. And if you have registered in the past, then my staff probably reached out to you earlier today. So make sure that you do that. In addition to that, if you go onto our Linktree profile, you will see, we have the TWW Plus membership on there. There's a free download to work out. There's also some pretty cool t-shirts that you can order and print on demand. So a lot of cool stuff if you go to our Linktree profile, but primarily we use it to register for the inflammation event. So you can still click on that and see if we have some space available for that. Coming up tomorrow, 6 p.m. Central Standard Time, right here, in-person event in Yorkville, Illinois. Now, before I go over anything in regards to skin conditions and things like that, I do want to go over something really interesting. And this just solidifies what I've been talking about probably for the last 15, maybe close to 20 years. But there was a meta-analysis that just revealed that the number one approach to blast visceral fat, and no, it's not doing crunches. It's not trying to do spot reduction or anything like that. So when we're talking about visceral fat, we're talking about fat around the organs. We're talking about some abdominal fat. And one of the best ways in order to get rid of that is the type of exercise that you are doing. And it's not trying to spot reduce by doing a bunch of crunches. All right. But what it actually revealed is something I've been talking about the last 15 years, and it's high intensity interval type training. High intensity interval type training. And this is why one of the most important things isn't the fact that I'm just randomly moving at a moderate pace. Do I think there's a place for that? Yes, but I don't think that it should be the primary way in which you are actually moving. There's a lot of different ways that you can exercise, and that's why I don't think that you should be getting locked into just doing one form of exercise, and that's your go-to. But one of the things that they have found is doing high intensity interval training. It's actually one of the best ways in order to start blasting visceral fat. Now, do you have to pay attention to your diet and nutrition? The answer is yes. Obviously, you need to do all of those things. However, doing some high intensity interval training is very, very important. And it's also something that people avoid quite a bit because yes, it can get uncomfortable. So what are some of the best ways in order to start incorporating high intensity interval training? And it would be doing a lot of different types of modalities. And guys, the opportunity is endless. There's so many different ways that you can do this. And it's not just running. All right. It's not just running. There's a lot of different modalities that you can do, like a Concept 2 rower. And if you've never heard of a Concept 2, just go on to, Concept 2 training. They have a ski erg. It could be a ski erg. It could be a rower. You also have the dreaded echo bike, although otherwise known as Satan's tricycle, hill sprints, or running up a hill, or it could be as simple as just doing burpees. And basically, what you do when you're talking about high intensity interval training, you're trying to have a work to rest ratio of about 1-2. So what that means is if I decided to do a row sprint for 30 seconds, you're going to go as fast as you can for about 30 seconds. And then you're going to try to recover as much as you can within about a minute. So you just take the time that you're performing the effort and then double the time so that you can do high intensity for multiple sets, not just for one set, but for multiple sets. So that's why, if you look at our workout book, the workout book is doing high intensity type training, which, guys, science has actually proved this. High intensity training is the best way in order to train. You should be doing functional movement done at a high intensity. And, that's why too, like you did 30 seconds of burpees, you allow for a minute to be able to recover, only so that you can come back and give another max effort. And usually doing it 4 to 5 times can have a profound impact on a lot of different things, including fat metabolism. So high intensity training is always going to be king. It's always going to be king. And that's why I'm such a fan of doing it. And I've been doing it for about 15 years now, give or take, a year or so. But I've been doing it for a very, very long time with an absolutely fantastic benefit. But you have to start doing that. You have to start doing high intensity type effort in order to have a pretty profound impact, especially when you talk about really signaling the body to start burning fat. And yes, you do have to pay attention to nutrition as well. So let's get into the meat and potatoes of what I wanted to talk about today. Common skin conditions that are not normal. Okay. Here's the first one. The first one, I'll show you pictures of it, but this is when you have the small colorless type bumps that don't really feel like anything that are on the arms. And a lot of times you will see them on the back of the arms. So yes, you can go to a dermatologist. Yes, they can, give you some kind of definitive diagnosis, but they're not going to do anything in order to start getting to the causes as far as why they're happening. One of the biggest reasons that I have seen clinically is that there is something inflammatory that's going on, and it just depends on what is causing that type of inflammatory trigger. Many times it actually can be the presence of different types of food allergies. Now, here's the interesting thing about your skin. Your skin is a barrier, just so you know that. It separates internal, external environments, so it's a barrier. Your gastrointestinal system is also a barrier because it's separating internal, external environment. And one of the interesting things is that if you look at your skin, there's going to be a lot of immune cells that are going to be anywhere around a barrier only because the body wants to handle any kind of foreign invaders before they're coming in. But the interesting thing is about your skin is that if there's a lot of gastrointestinal inflammation, then the skin will tend to get inflamed as well. And the reason why is just because when there's an inflammatory response, the immune system will secrete certain inflammatory chemicals that will be picked up on to different parts where the immune system is also sitting, which means it is sitting around the skin because it is in fact a barrier. So just so you know that, if you know that an inflammatory response happening somewhere else can cause skin reactions, is look at a child with an anaphylactic food allergy, like an IgE food allergy, and this might be a +3, +4. You give them that food and they break out in hives. Okay, so it's the immune system receiving a signal from the actual blood or from the actual gastrointestinal system that sends that message to the skin, which is why you can see so many other changes take place when there's an inflammatory response happening in a different part of the body. So if you have any kind of issues with, like the chicken skin or the colorless bumps, and you'll see them on the back of the arms, then you want to be checking for what is inflaming the body. And many times it can be the exposure to a protein from a food that the immune system starts reacting to. Just remember this: the immune system reacts to foreign proteins, and that might be a food, that might be a bacteria, that might be a virus, that might be a toxin. That's the whole job of the immune system, is respond to proteins that don't belong there. So the other one that I want to talk about is rosacea, when you start getting the inflammation around the cheeks. And yes, sometimes it can cross over, on the tip of the nose and cross over the bridge of the nose. Some of this will leave you some clues, but if you have issues with rosacea, it isn't just a skin issue. Many times this can be an autoimmune issue. And no, the immune system is not attacking healthy tissue. Just so you know that. The immune system's not attacking a healthy tissue. It's not programmed to do that. There could be something that is very, very triggering to the immune system. And that's why if someone has rosacea, you really want to look at the gastrointestinal system. But you also want to look for any kind of autoimmunity that might be going on. And this might be lupus. This might be rheumatoid arthritis, which is a highly inflammatory condition that's going on. And the inflammation that turns up in other parts of the body will start to show up into the skin. And this is why, if you have anything going on in the cheeks, then there is something very highly inflammatory inside of the body. I know that my wonderful wife, she suffered, with rosacea, in the past, and she would get the redness and the inflammation on the cheeks. She would get it on the nose, and that's gone away. And this is without dumping antibiotics or doing any kind of excessive skincare or something like that. Once you figure out where it's coming from, then you will see the skin start to clear up as well. Now, here's the third thing that I want to go over with you too, and this is loss of hair on the ankles. Now, I did talk about this last week, but if you are losing hair on your ankles, no, it's not just from friction. The reason why is because why can two people, both wear socks and one still grows hair on their ankles and the other one doesn't, but everybody wants to blame their socks. But what does loss of hair on the ankles, what does it actually mean? Well, it could mean a couple of things. It could mean that this person has a very, very high amount of dihydrotestosterone, which is a derivative of testosterone, much more powerful form of testosterone. And not only will you lose hair on the ankles, but you also will lose hair on the top of the head. Okay. The other thing that it can mean is it can also mean, some kind of peripheral artery disease. And that's going to be usually due to some level of high blood sugars that's damaging the arteries. So it can be, yes, it could be hormone conversion issue. It can also be a peripheral artery issue. And usually, actually for both of them, it can be linked to having elevated blood sugars. But that's why one of the biggest things too, if you are measuring and someone might be high in DHT or a derivative of testosterone, that's why you can take some things in order to shunt the effects, because what also can cause a lot of prostate swelling is high DHT. And this is why things like saw palmetto, reishi mushrooms, and things like that can actually shunt away the conversion of testosterone into DHT in order to help preserve, the hair follicle, but also help to preserve some of those organs that are very receptive to high levels of DHT. In men, it's going to be the prostate. Okay. Now, what about toenail fungus? What about toenail fungus? All right. Developing a toenail fungus isn't because you lost a toenail, because I've lost a toenail in the past. Boy, that was painful, but it didn't grow in with a fungus. So if you have a toenail fungus, here's what I want you to really, really consider is if you have, your toes are growing a lot of toenail fungus, or you're getting a lot of the white spots underneath, or they're just not growing the way that they're supposed to, you probably got a toenail fungus. And at that point, I would be looking at the immune system, because if you look at people as they get older and they have more of a tendency to have a toenail fungus, this can be a real problem with a couple of things. Number one, with the immune system response. And then number two, it could also be a nerve system response. And I'll give you a perfect example. If you look at people who have really, really bad degenerative lower backs, that can actually cause problems with the neurovascular supply going into the area. Now, watch this. If you are having an issue with the tip of the toes, because the nerve distribution to this is going to be coming from, S1 from the L5 disc. Could also be, depending on where it's at the L5 and also at the L4 nerve roots. But if you start developing a lot of pressure into that area, well, that's going to affect the neurovascular supply into that area. And if the vascular system can't get into the toes, how on earth are you supposed to get the immune system in there? So toenail fungus can absolutely be poor immune system function. And it could also be a sign of poor nerve system function, which is why getting an x-ray can be so important. Now, how about dark circles around the neck? Okay. I talked about this last week, and I wanted to talk about it again just because a couple of people had asked about it. But dark circles around the neck, if you get the discoloration, the skin will almost turn almost a dark brown, almost a purple, and feel very velvety. This is an issue with insulin resistance. And usually, because you do have insulin resistance, you're going to have very, very high cortisol levels as well. In fact, if you look at people who have problems controlling their blood sugar, they'll typically will have very elevated levels of cortisol. And in fact, you will see this in people who have type 2 diabetes. You'll see people who suffer with obesity. You will see this very common. You could also see this in women who have PCOS, because typically they do have some level of insulin resistance, which is going to lead to very, very high cortisol levels as well. Then you'll have some changes on the skin like age spots or liver spots. And so this is now everybody's going to look on the back of their hand to see if they got some kind of age spots or liver spots. But you will see people develop this over time, or maybe you might only be in your 40s and you're already starting to see these liver spots or these age spots start to develop. And what does that mean? Well, one of the things that it means is this is a result of what's known as advanced glycation end stages, and usually the culprit is actually issues with elevated blood sugars. So the thing that happens is if you have elevated blood sugars for a long period of time, this is why you have to get your blood sugars down. For so many people, they have to get their blood sugars down. And I would say 50 to 60% of people are just running high levels of insulin, higher blood sugars than what they need to be. But one of the things that happens is if you leave elevated blood sugar for a long period of time, then one of the things that elevated blood sugar will do is it will damage your soft tissues, which is going to include your skin. It's going to include your joint capsules, especially. It's also going to include your arteries as well, like the endothelial lining. And if that you get a sugar that attaches to it and starts to cause damage to that, well, the immune system has to respond to that because now it's the damaged cell, and that's the job of the immune system is actually to go after tissue injury, damaged cells, infected cells, things like that. But over time, one of the things that it'll do is it will just cause breakdown of the skin. And that's why if you start seeing it on the back of the hands, you start seeing it around the forehead, you start seeing it around on the cheeks, that can be a sign of having some elevated blood sugars for a long period of time. And you really got to work on getting that under control. Now, the one that everyone has been waiting for is the dreaded hump on the back, or otherwise known as the granny posture. So what I'm talking about is if you look at the upper part of the back and there's kind of a fat pad there, there's kind of a hump that's back there. What does that mean? Okay. What does that mean? Well, it can mean a couple of things. You will get kind of that, what they would call a buffalo hump, if you have very elevated levels of cortisol. And yes, that can be due to Cushing's disease. And at that point, it's probably, some kind of adrenal tumor. But if you generally have high levels of cortisol, you will also develop that hump in the back as well. And if you look at elevated cortisol, there could be a lot of different reasons. It's not just due to stress, but it can be related to your blood sugars as well. But one of the things that a lot of people don't ever call into as being a cause is having what is known as excessive forward head posture. Excessive forward head posture, in which that hump on the back is basically just an adaptation to the spine carrying an excessive amount of stress. And in fact, if you look here, and if you look at how you line up with gravity, this person is not lining up with gravity. So you can see that their head is going excessively forward in front of the body. And you would see that now it turns a 12-pound head. And if you look at just physics with the moment arm, you can see that that's going to cause a lot of shear force on the lower part of the neck. Now, one of the things that has to happen is the body has to try to adapt to doing this. And as it adapts, it will cause, the formation of kind of like fatty tissue into there. It will cause a lot of adaptation into the neck. And I'm going to go over what it actually causes. But yes, this right here will cause an adaptation because leave it there long enough and the body has to start adapting to it as well. And in fact, if you want to see what this looks like on an x-ray, right here is a perfect example of someone who had an awful, awful granny hump, granny posture, whatever you want to call it. But if you look at it on the inside of what it looks like on the x-ray, here's the eyes, here's the teeth, here's the back of the head. This black line is actually an outline of the bones in through the neck, and the red line is normal. That's where it should be lining up. So basically what you are seeing is that you are seeing, instead of lining up with the head directly over the spine, lining up with gravity, you will actually see more in through this when you look at this on an x-ray. Okay. So you can see on the x-ray, the black line being her, and then the red line, which is normal, how far off that this individual is. And you can start to see the adaptation that starts to take place as a result. So one of the things that you will see is you will see a lot of calcification start to take place. And this is just the body trying to adapt to a lot of the stress that's taking on. But if you look at what happens when someone has an excessive amount of forward head posture, here's some of the things that will happen. They will start to develop a lot of spine stiffness. The spine will start to lose a lot of flexibility. What you'll also start to see is you'll start to see a loss of shoulder mobility because it's not going to start affecting the neck. The lower part of the back has to adapt with this to try to line up with gravity, but you'll start losing a lot of shoulder mobility or the ability of you to be able to flex your arm. This is why when people have a lot of forward head posture, they can't flex their arms up the way that they're supposed to. But it's not just losing shoulder mobility. You start to see changes within the tissue because you'll also will see plaquing of the carotid artery. You mean that this is a risk factor for stroke? Yes, I'm absolutely saying it. And the reason why, because when that head starts to go forward, you start changing the fluid dynamics of the carotid artery. And in fact, one of the things that will happen is that it will start to cause stress on the carotid artery, even on the vertebral artery. And then with that constant stress, then one of the things that starts to happen is that it will start to lay down plaque within that area as a response to changes in fluid dynamics within those arteries. The other thing that you'll do is you'll start to lose the mobility of the cerebral spinal fluid to the brain. So the only way, like the way that the brain gets nourished is through a vascular supply, which is going through the vertebral arteries, which is going actually through here. But then you also have the carotid artery. But 2/3 of the nutrition going to the brain is going through cerebral spinal fluid. And the only way that you can get cerebral spinal fluid to the brain is actually through proper motion of the spine, of the pelvis, and actually of the upper part of the neck. But when the neck is in this position, it's not going to flex and extend the way that it's supposed to in order to pump that fluid back up into the brain. So you start losing cerebral spinal fluid to the brain. It can also cause disc herniation and arthritic changes, which is what you're seeing here. Is a lot of arthritic changes take place. You also see some arthritic changes moving up. You'll also see changes in your facial structure. You'll start to see that the structure of the face will start to change. And how does it start to change? Well, this is why if I looked at someone's face, I could pretty much tell them what the curve in their neck looks like. Because if you have a loss of curve, hypolordosis, or you have a cervical kyphosis, which is a reverse curve in through the neck, you'll start to see the facial structure start to change. But also when the head goes in a excessively forward position, you will start to see the jowls start to sag. You'll start to develop a hump on the back, but you'll see the whole entire facial structure start to change. But the other thing neurologically, why this can be so bad and so damaging, is it just puts this person in a state of chronic fight or flight. So chronic fight or flight. Now, I've talked a lot about chronic fight or flight and the need, for so many people, there's a need to get adjusted because there is so much chronic fight or flight, or they have a posture that looks like this. But if you're in chronic fight or flight, this is going to change the production of stomach acid. This is going to change gastrointestinal motility. This is going to change so many different things. And this is why I've talked about it, why being chronic fight or flight is so bad for the body, how it changes your circadian rhythm, your sleep cycles, your digestion, your ability to be able to break down proteins, and with digestion, your ability to have bowel movements and things like that. And this is why when we start correcting this in people, they'll come to me, they'll be like, am I crazy? Or why am I digesting better? Why am I sleeping better? Why do I generally feel so much better? And we're just getting them out of chronic fight or flight. This is why this is so important. This is why getting an x-ray can be so important. But if you look at this person with their head going terribly, terribly forward in excessive forward head posture, and you can see how that they've developed a hump on the back because you can see that tissue even on an x-ray, okay? So this is why doing some things at home, this is why getting an x-ray is so important. This is why making sure that the person that you are working with isn't going to give you just some generic exercises, but they know how to do things like unlocking the skull to be able to, for head retraction, head weighting, vibe platform, doing some things in order to help start to correct that. And this is a very difficult case. If this person comes in, they're going to have to work very hard for a long period of time in order to get that corrected. However, one of the biggest things is that there is no herb, there is no supplement you will not be able to out supplement this because this is a physical stressor that demands a physical solution. And this is why, guys, you need to start looking at the body as a Swiss watch, okay? You have to start looking at how the body starts to work, because if you look at a Swiss watch, all of these different organ systems need to be healthy and working together in order for everything to be working the way that it's supposed to. And this is why, if we have a problem with the skin, we go to a dermatologist, and the only thing they look at is they look at the reaction taking place into the skin. But if you have a skin issue, you really got to look at the digestive system. You got to look at how all these other organ systems are getting affected. And this is why, guys, when we have some kind of health issue, then we go and we run to the specialist, and the specialist only looks at just that one organ system without looking at everything, how it's affecting everything else as a whole. And this is why people are so frustrated with healthcare. And the reason why they're frustrated with healthcare is because they keep going to a specialist who knows more and more about less and less until finally they become experts in nothing. If you want true healthcare, then one of the things that you need to be doing is you need to have a doctor who knows how to look at all of these different organ systems and knows how to start improving the health of those things. Because when you start improving the health of the nerve system, the skeletal system, the digestive system, then it will start to affect the skin. It will start to affect the immune system. It will start to affect the respiratory system, the endocrine system, circulatory system. And this is why you have to start looking at everything as a whole. And this is why people will call me crazy when I say your big toe controls your heart. And they're like, nah, no, it doesn't. I'm like, okay, take off your shoe, give me a hammer. I'll start smashing your big toe, and let's check your blood pressure after that happens. And you will then agree at that point that yes, your big toe could even affect your blood pressure. So here's my final thought, because people will always ask me, what supplement do I need to take? But guys, I can't stress this enough. The final thought is this, is work on building health and stop trying to treat everything, okay? I hate the word to say he's treating me. I'm like, you know what I'm really trying to do? We're trying to build health. The reason why, guys, is the body already is programmed on how to heal. It just can't heal if you keep injuring it. So one of the things that you have to do is understand where inflammation is coming from, and then know how to stop the chronic inflammatory response, because it's then and only then can you start to rebuild your tissues. Because remember, I'm never going to rebuild my ankle if I sprain it every single day. The first thing I have to happen is figure out why I'm spraining it, and then stop spraining it and allow the tissues to be able to heal the way that they're supposed to. But you just can't be so chronically inflamed. And in fact, this right here, this can also be an effect of being on long-term corticosteroids. So what doctors are going to give you to try to knock out the immune system response, because they know that it's being caused by inflammation. And I agree with that. But where do we start to take a different path? On trying to figure out what's causing it, because doctors will just try to cut out the tongue of a baby that's crying. But I want to figure out why the baby is crying so we don't have to cut out the tongue. Okay. So just work, guys, on starting to build health and stop trying to treat everything with some kind of this for that approach. You got to stop treating things and start to understand what health is, where it comes from, and what you need to do to start functioning at a much higher level without a chronic, unrelenting inflammatory response. And this is why, guys, coming up Tuesday, April 29th, this is tomorrow at 6 o'clock p.m. If you have any of those conditions, and one of the things I want you to do, if you're from the Chicagoland area, I want you to go ahead, click the link on our Linktree profile, and click that and register yourself for that inflammation event that's going to be tomorrow at 6 o'clock p.m. We have a special gift for you at that event. So make sure that when you come, that you introduce yourself. And my staff is absolutely awesome and wonderful. They will take great care of you for that event. So just go ahead and click on that link on my Linktree profile. It'll take you 60 seconds to get registered for that. Okay. So common skin conditions that are absolutely not normal. So guys, your skin is giving you a clue, and it's time for you to start taking it seriously and to start listening before it turns into some kind of full-blown disease, and before you get to the point where I can no longer help you because it's so far gone. So I will be going live next week. That will be next Monday, but I think it's going to be a question and answer. So if you have any questions, put them in here now so that way I can take them and try to do a good job of answering those questions. But I will be doing a live question and answer next week. The reason why I'm not going to have a topic is because I will be traveling to Green Bay, Wisconsin, to the Leadership and Longevity seminar that's being put on. It's going to be an absolutely awesome, fantastic seminar. Thousands of people are going to be going to that, but we will hear awesome speakers. It will be a fantastic event, but I'll be at that event, as well. So I won't have time to come up with a whole live topic for that. So I think I'm just going to, just do a live question and answer instead, because I think that's what people actually like the most. So I will be back here at around 7:00 p.m. Central Standard Time, YouTube, Facebook, Rumble, to go live and answer your questions. So have your questions ready for that, because I'd be happy to answer those to you so that we can have an awesome live broadcast. So next week, I will be coming back from Green Bay, Wisconsin, for a live question and answer. So guys, common skin conditions that are certainly common, but they're absolutely not normal. Make sure that you start working on that before it's too late. So guys, thank you so much for watching this live broadcast. I love all of you. I appreciate all of you. Thank you again for watching. Make sure that if you don't follow us, make sure that you give us a like, give us a follow. Please share this video with other people. And I will see you guys next week. Be well, be blessed. Remember who you are. And I will see you guys very, very soon. Be well.